Hello, everyone. Welcome back to A1 English Podcast, the show where we make English simple, practical, and stress-free.
Hi, everyone. I'm Jessica.
And I'm Jack. We're really glad you're here with us today.
Before we start, a quick reminder. If you're learning English, especially for your career, please like this episode and subscribe to our channel.
Yes, because subscribing means you'll never miss an episode that could help you in your daily life or your job.
Okay, so today's topic is something very special and very useful.
Yes, today we're talking about English for doctors, the medical vocabulary you need to know.
This is such an important topic, whether you're a doctor, a nurse, a medical student, or even just a patient visiting a clinic abroad. This episode is for you.
Exactly. Many people study English for years, but when they walk into a hospital or clinic, they suddenly feel lost.
It's true. Medical English has its own vocabulary, its own expressions, and even its own way of asking questions.
So today, by the end of this episode, you'll feel much more confident talking about health, symptoms, body parts, and medical situations.
Not perfect, but confident. And that confidence can really make a difference, especially in an emergency.
All right, let's start easy. No stress, no boring textbook style.
Just real English, real conversations, and real situations you might face at a doctor's office or hospital.
Okay, Jessica, let me ask you something. Have you ever traveled somewhere and had to explain a health problem in English?
Actually, yes. Once I had a headache while traveling, and I didn't know how to describe it properly to the pharmacist.
That's exactly the kind of situation we want to prepare our listeners for today.
Right, and it's not just about traveling. If you're studying medicine or nursing or working in healthcare, this vocabulary is essential every single day.
So let's break it down step by step. First, let's talk about the basics. What do we mean by medical vocabulary?
In simple words, medical vocabulary means the words and phrases we use to talk about health, illness, body parts, symptoms, treatments, and medical professionals.
Perfect. That's all you need to understand to get started.
Now, why do people get confused with this topic?
Usually, it's because medical words can sound very formal or very different from everyday English.
And also because there's a difference between how doctors describe something and how a normal patient would describe the same thing.
Exactly. For example, a doctor might say gastrointestinal discomfort, but a patient would simply say, "My stomach hurts."
That's such a good example. So today, we'll cover both sides, the patient language and some professional vocabulary too.
We'll use real-life examples, not just textbook lists.
Because real conversations are the best teacher.
All right, let's move to our first key point, describing symptoms.
This is super important because almost every medical conversation starts with describing how you feel.
Exactly. When we talk about symptoms, we usually use phrases like, "I have a headache," or "I feel dizzy," or "I have a sore throat."
Let me give a real-life example. Imagine you're at a doctor's clinic and the doctor asks, "What seems to be the problem today?"
Okay, I'm listening.
You could say, "I've had a fever and a cough for the past 2 days."
Perfect. That sounds very natural and clear.
Now, many learners make a small mistake here. They might say, "I have fever since 2 days."
Oh, yes, I hear that a lot.
The problem is the grammar. In English, we say for 2 days, not since 2 days. And we usually say a fever, not just fever.
So the correct way is, "I've had a fever for 2 days."
Exactly. Let's give another example to make it even clearer.
Good idea.
Think about explaining pain. Instead of saying, "My stomach pain very bad," you would say, "I have a sharp pain in my stomach."
And notice how we use sharp, dull, or throbbing to describe the type of pain?
Yes, that's the key. These descriptive words help the doctor understand your condition much better.
So remember, when you describe pain, use words like sharp, dull, throbbing, mild, or severe, plus the location of the pain.
Not complicated at all, right?
Not at all. Let's add a few more useful symptom phrases. I feel nauseous. I'm having trouble breathing. My throat is sore. I feel dizzy when I stand up.
These are phrases you can use almost every day if needed, and they sound very natural.
Also, common symptom nouns: a headache, a stomachache, a backache, a toothache, a fever, a cold, a cough, a rash, and swelling.
Great list! Now let's move to our second key point.
Okay, now let's talk about body parts and medical terms for the human body.
This one is equally important because doctors often ask, where exactly does it hurt?
Right, so let's go through some essential body part vocabulary. We have the head, neck, shoulders, chest, abdomen, back, arms, and legs.
Let's make this super practical. Imagine you're at the doctor's office and you have pain in your lower back.
What would you say?
You would say, I have a pain in my lower back, especially when I bend down.
Perfect. And why does that work so well?
Because it gives the location, lower back, and the situation when it happens, when I bend down. This helps the doctor understand the cause.
Now here's a common mistake.
Oh, let's talk about mistakes. These are so helpful.
People often say, my leg pain is there from morning.
And the problem with that is the grammar structure. In English, we say, my leg has been hurting since this morning.
Much better. Let's continue with internal organs, since this is also very common in medical conversations.
Sure, some important internal organs are the heart, lungs, liver, kidneys, stomach, and intestines.
For example, a doctor might say, we need to check your kidney function with a blood test.
Or a patient might say, I think I have a problem with my liver because my skin looks yellow.
That's a great example because it connects a symptom, yellow skin, to a possible organ problem.
Let's practice one more time. How would you describe chest pain that happens when you take a deep breath?
Pause for a second, everyone. Try to make your own sentence.
Here's one possible answer. I have a sharp pain in my chest when I take a deep breath.
Did you get it right? If yes, amazing. If not, don't worry. That's exactly why we're here.
Learning medical vocabulary takes practice, and mistakes are part of the process.
All right, Jessica. Now let's talk about medical professionals and places, because this is also part of everyday medical English.
Great idea. Let's start with people. We have the doctor, the nurse, the surgeon, the dentist, the pharmacist, and the specialist.
And different types of specialists too, like a cardiologist for the heart, a dermatologist for the skin, a pediatrician for children, and a psychiatrist for mental health.
Now let's talk about places: the hospital, the clinic, the emergency room, the pharmacy, and the waiting room.
Here's a useful phrase: I need to make an appointment with my doctor.
Or in an emergency, we need to go to the emergency room right now. It's urgent.
Now let's talk about a very important section: medications and treatment.
Yes, this is something everyone needs at some point.
Common words include medicine, tablet, pill, injection, prescription, dosage, and side effects.
For example, a doctor might say, take this tablet twice a day after meals.
And a patient might ask, are there any side effects from this medication?
Very useful question. Let's also talk about a common mistake people make here.
People sometimes say, I am taking medicine since 1 week.
The correct way is, I have been taking this medicine for 1 week.
Another mistake is saying, doctor gave me injection yesterday. The correct way is, the doctor gave me an injection yesterday.
Small words like a and an matter a lot in English, even if they seem unimportant.
And the last common mistake, I am feeling better, no need medicine more.
The correct way is, I'm feeling better, so I don't think I need any more medicine.
Now, if you make these mistakes, don't panic.
Everyone makes mistakes. Even native speakers sometimes mix up medical terms.
The important thing is to keep practicing and keep speaking.
Silence is worse than a small mistake, especially in a medical situation where clear communication really matters.
Okay, let's put everything together with a full conversation example, just like a real visit to the doctor.
Yes, let's make this really practical. Imagine you walk into a clinic because you've been feeling unwell for a few days.
The receptionist might say, "Good morning. Do you have an appointment, or is this an emergency?"
You could respond, "Good morning. I don't have an appointment, but I've been feeling really unwell since yesterday."
Then the doctor comes in and asks, "What seems to be the problem today?"
You answer, "I have a high fever, a sore throat, and a headache. I also feel very tired."
The doctor might then ask, "Do you have any pain when you swallow?"
And you respond, "Yes, it hurts quite a lot when I swallow, especially in the morning."
After checking, the doctor might say, "It looks like you have a throat infection. I'll prescribe some antibiotics."
And you could ask, "How many times a day should I take this medicine, and are there any side effects I should know about?"
See how natural that sounds? This is real medical English, the kind you'll actually use.
Exactly. Now, everyone listening, I want you to try something.
Think of a symptom you've had before, maybe a cold, a headache, or a stomachache.
Now, try to describe it out loud in English using the vocabulary we covered today.
Even if you're alone, say it out loud. It really helps your brain remember the words.
And if you make a mistake, that's okay. Say it again and again. That's how learning works.
Now, before we wrap up, let's add one more very useful section: emergency English.
Yes, this is so important. In an emergency, you don't have time to think slowly, so these phrases need to come out automatically.
If something serious happens, you might say, "Call an ambulance, please. It's an emergency."
Or, "He's not breathing properly. We need help right now."
Another useful one is, "She fainted suddenly and hasn't woken up."
And if you're describing an accident, "He fell down the stairs and hurt his leg badly."
At the hospital, the staff might ask, "Is the patient allergic to any medication?"
You might answer, "Yes, he's allergic to penicillin," or "No, as far as I know, there are no allergies."
Other useful emergency words are bleeding, unconscious, broken bone, burn, choking, and faint.
For example, "She's bleeding from her arm. We need a bandage immediately."
Or, "I think he's choking. Someone call for help."
These short, clear sentences can genuinely save time in a real emergency, so it's worth practicing them out loud.
Now let's talk about another everyday situation: going to the pharmacy.
This happens so often, even for small problems like a headache or a cold.
At the pharmacy, you might say, "Could you recommend something for a headache?"
The pharmacist might respond, "Sure, these tablets work well. Take one every 6 hours and don't exceed 4 tablets a day."
You could then ask, "Is this safe to take on an empty stomach?"
Or, "Can I take this together with my other medication?"
These questions are extremely useful because medication safety really matters.
Another common phrase is, "Do you have anything for a cough and a blocked nose?"
And the pharmacist might say, "This syrup helps with the cough, and these nasal drops will help clear your nose."
Notice how natural and simple these conversations are. There's no need for complicated grammar, just clear, polite, everyday English.
Exactly. And one more useful phrase for the pharmacy: "Do I need a prescription for this, or can I buy it directly?"
Great question to know, especially when traveling to a new country with different pharmacy rules.
Let's also quickly cover some vocabulary related to medical tests and checkups, because this comes up a lot too.
Good idea. Common test-related words include blood test, X-ray, scan, ultrasound, blood pressure, temperature, and pulse.
A doctor might say, "Let's check your blood pressure and your pulse first."
Or, we'll need to do a blood test to check your iron levels.
If something looks unusual, the doctor might say, "We'd like to do an X-ray, just to be safe."
And as a patient, you could ask, when will the results be ready? Or, is this test painful?
Very practical questions. Let's also mention some words related to recovery and follow-up.
Words like recovery, rest, follow-up appointment, improvement, and discharge.
For example, you're showing good improvement, but you'll need a follow-up appointment in 2 weeks.
Or, you can be discharged today, but please rest for the next few days.
These phrases are perfect for understanding what happens after treatment, which many learners forget to study.
So true. People focus on symptoms, but forget about recovery vocabulary, which is just as important.
Now, let's do one more practice round before we finish, this time focused on mental health, because it's an important part of overall health too.
Yes, and many people find it hard to talk about this in English.
Useful phrases include, "I've been feeling very stressed lately," or "I'm having trouble sleeping because of anxiety."
A doctor might respond, "How long have you been feeling this way?" Or, "Have you noticed any changes in your appetite or energy levels?"
You could answer, "It's been going on for a few weeks, and I just feel tired all the time, even after sleeping."
These are sensitive topics, so it's good to know gentle, clear language to describe how you feel.
Absolutely. Mental health is health too, and having the right words makes it easier to ask for support. Before we move to the review, let's also talk about something many learners forget, talking about chronic conditions and ongoing health management.
That's a great point. Chronic means a condition that lasts a long time, like diabetes, high blood pressure, or asthma.
If you have a chronic condition, you might say, "I've been managing diabetes for about 5 years now."
Or, I have to monitor my blood sugar levels every day.
A doctor might ask, "Are you taking your medication regularly, and have your levels been stable?"
Yes, I take it every morning, and so far it's been under control.
For asthma, you might say, "I sometimes get short of breath, especially when I exercise, so I carry an inhaler with me."
And for blood pressure, my blood pressure has been a bit high recently, so the doctor adjusted my medication.
These phrases show that you're actively managing your health, which is something doctors really appreciate hearing.
Definitely. Let's also mention vocabulary about lifestyle and prevention, since doctors often give advice about this.
Common words: diet, exercise, sleep, stress, smoking, and alcohol consumption.
A doctor might say, I'd recommend reducing your salt intake and trying to exercise at least 3 times a week.
Or, "It would really help if you could cut down on smoking, even gradually."
You could respond, I understand. I'll try to make some changes to my diet and get more sleep too.
These conversations about lifestyle happen all the time, especially during regular checkups, so it's good to be comfortable discussing them. One more thing before we finish. Let's talk about vocabulary for dental visits, since doctor often includes dentists too.
Good thinking. Common words are toothache, cavity, filling, root canal, braces, and dentist.
You might say, "I have a really bad toothache on the right side, especially when I eat something cold."
The dentist might respond, "It looks like you have a cavity. We'll need to do a filling today."
And if it's more serious, "Unfortunately, you'll need a root canal treatment for this tooth."
You could ask, "Will this be painful, and how long will the treatment take?"
The dentist might say, "We'll use local anesthesia, so you shouldn't feel much pain, and it usually takes about an hour."
Great vocabulary for a situation almost everyone will face at some point.
Now, here's a fun challenge for everyone listening. I'm going to describe a situation, and Jessica will respond using today's vocabulary.
I'm ready.
Okay, imagine you woke up this morning with a stiff neck, a slight fever, and a runny nose. You decide to call your doctor's clinic.
I'd say, hello, I'd like to book an appointment, please. I woke up with a stiff neck, a slight fever, and a runny nose, and I'd like a doctor to take a look.
Perfect. Now imagine the doctor asks, on a scale of 1 to 10, how would you rate your pain?
I'd say it's about a 4. It's uncomfortable, but it's not unbearable.
Excellent. That's exactly the kind of natural, confident answer we're aiming for.
Everyone listening, try this challenge yourself. Pick a symptom, imagine the doctor's question, and answer out loud.
The more you practice these small role plays, the more natural, real conversations will feel. Let's also quickly go over some useful adjectives that describe how someone is feeling overall, since these are used constantly in everyday medical conversations.
Great idea. Words like exhausted, weak, feverish, nauseous, congested, and achy.
For example, I've been feeling really weak and achy all over since yesterday.
Or, I'm congested, my nose is completely blocked and I can barely breathe through it.
These adjectives paint a much clearer picture for the doctor than simply saying, "I feel bad."
Exactly, and they're easy to remember once you start using them in sentences.
One last tip before we wrap up. Always feel free to ask the doctor to repeat or explain something if you don't understand.
Yes, you can simply say, "Sorry, could you explain that again in simpler words?" Or, "Could you write that down for me, please?"
There's nothing wrong with asking for clarification, especially with medical terms that are new even to native speakers.
Doctors are used to these questions, and it shows that you're paying attention and taking your health seriously.
All right, let's quickly review what we learned today.
First, we talked about how to describe symptoms clearly, using phrases like, "I have a fever," or "I feel dizzy."
Then we explained important body parts and internal organs and how to describe pain using words like sharp, dull, or throbbing.
We also covered medical professionals, places like the hospital and clinic, and vocabulary about medications and treatment.
And most importantly, we practiced a full, realistic conversation between a patient and a doctor.
Remember, you don't need to be perfect when speaking English.
You just need to be clear, confident, and willing to keep practicing.
Especially in medical situations, clear communication can make a real difference.
So keep practicing these phrases, even just a few minutes every day.
If this episode helped you understand medical English better, please give it a like.
And if you want more practical English lessons like this one, don't forget to subscribe to A1 English Podcast.
We upload new episodes regularly to help you improve your English naturally and confidently.
Thank you so much for learning with us today.
Keep practicing, keep improving, and take care of your health too.
Bye, everyone.
See you in the next episode.